Hey, this is Taylor. I think I just missed your call.
Hey, how are you doing?
Hey, I'm doing all right. I assume this is Caitlin?
Yes.
Hey.
So if you have a few minutes, it really shouldn't take long at all.
Sure.
All right, perfect. Do you know what I want to talk to you about, kind of, Mr. Jermaine Jones, Jr.?
Yeah, I mean, I'm familiar with, like, the case and
Okay.
And then I know there's, like, investigation going on.
Right. Do you remember treating him on October 11th?
Yes.
Okay.
I do.
So just kind of tell me what you remember, if you remember any law enforcement that said anything, or if you were told what happened.
So essentially the handover I recall getting from the officers that brought it in was that there was a traffic stop, and it's at some point during that stop they like started searching the vehicle and like found a weapon, and he tried to flee the scene, and they tased him. And then they said that as they were, I mean, they made it sound like it was a fairly uneventful struggle other than tasing him.
Mm-hmm.
And that they got him in the vehicle, and around the time they got him to the prison, he started to act strange, and they thought he was trying to fake like having seizures to try to like avoid going to jail.
Yeah.
That was kind of essentially the sign over I got from them.
Okay. When you saw him, was it in the ER or up on a floor?
It was in the ER, and
Okay.
they brought him down to like the one of the like acute, essentially like psychiatric care areas in the ER initially, because it was kind of a psych complaint kind of story that we were getting from them, and then once we realized there was more going on there, then we moved him over to one of our like ER ICU areas.
Okay. And forgive me for asking, I'm just not super familiar with,
Sure.
the terminology and stuff. I know you're Dr. Payne. I know there's like residents and attendings and all this different stuff. So what is your like title like that, I guess?
So I'm a resident.
Okay.
I'm a first year ER resident. I graduated from medical school a couple years ago.
Okay.
I worked a year of like I did a different specialty last year.
Okay.
And then started working in the ER in July.
Okay.
Or I should say I started the ER residency in July. I'd worked some months in the ER prior to that as well.
Okay. I gotcha. Okay. I just wanted to clarify that because I know there's different, I don't know if they're level, like what it is, but I just know there's different stuff in the ER. So, is there anything else that you remember seeing him, like if you remember seeing any external injuries or anything?
So he didn't really seem to have a lot of obvious external injuries. There were a couple of spots on his wrist where it looked like he had been injured from like the cuffs that had been placed on him,
Sure.
and from him like pulling at the cuffs.
Mm-hmm.
There was like a spot on the back of his head where there was a small, like just a little scrape
Right.
on the back of his head, and then there were some scrapes on his like chest and shoulder as well.
Gotcha.
There was nothing initially that stood out as being like a major, obvious sign of like external trauma.
Okay.
But with like head injuries, sometimes you can have some pretty severe, injuries inside the head without obvious like external injuries. So.
Okay. And once he left the ER, did you have anything else to do with his treatment that you remember?
No, they took him. The neurosurgeons took him directly to the operating room from the ER once we were able to get his CT scan done, and after that I was no longer involved in his care.
Okay.
He went to the ICU after that.
Okay. Do you think what you saw could be consistent with him like falling, or I don't know if you're gonna be able to answer that or not, but
You said consistent with what?
With like a fall from being tased.
It seems like that would be extremely unlikely to me.
Okay.
I mean, when someone has like a bleed inside the head, there's basically like one of 4 different like compartments in there that you can bleed into. And typically with like traumatic injuries, you see maybe 1 or 2 of them, at least in my experience. And he had like blood in all four of those areas, which to me, seemed like there was probably a much more severe mechanism injury than just falling down after getting tased.
Okay.
I think the neurosurgeons and the trauma surgeons involved may be able to give you a little bit more of an in-depth answer on that than I can, but at least from my experience, that seems highly unlikely.
Okay. Do you know who any of those are, the neurosurgeons that you were talking about? If not, I can go back and look at the paperwork and see.
So I know Dr. White was the trauma surgeon that initially, she was the attending trauma surgeon that was initially involved in this case.
Okay.
I don't know who the attending neurosurgeon was. The neurosurgery resident that saw him and took him to the OR initially, it was my first time meeting him. I can't recall his name off the top of my head either.
Yeah. Okay. That's fine. It should all we got the medical records I think last week, so that should all be on there.
Okay.
Is there anything else that you remember that you think might be important to us? Anything we might need to know about?
So there were like a couple of things I saw in the ER that kind of stood out to me as odd as well. One being that at one point, like after he arrived, he was kind of uncooperative and combative and not really responding to like us trying to kind of redirect him or see if he could kind of cooperate with our initial evaluation.
Right.
And so he ended up getting restrained to the bed with our restraints, and then the officers had him restrained as well, tied to the bed with cuffs on both sides, and we were getting medications drawn up to get him to calm down. And he's not waiting on the medications. He's still kind of thrashing on the bed some, but even though he was already in 4-point restraints, one of the officers was yelling at him that he was going to tase him again if he didn't stop moving around, which he seemed rather excessive for someone who's in the hospital already in 4-point restraints and about to get medicated. So that kind of rubbed me the wrong way.
Do you remember, and you probably don't know a name, but what they looked like or anything, the officer you're talking about?
So I saw when the investigation got started, and pictures got sent out, I figured out I think his name was Leslie Brown or something like that. I remember seeing the pictures of them. One of the other residents sent me the story when the news came out that the GBI was looking at the case and all that, and so I was looking at the pictures. I believe it was him. Okay.
Do you remember what he looked like?
He was the officer who gave me the report. I think he's sort of muscular, heavy set, African American. Okay. Maybe around 5'11", 6 foot or so.
Okay.
I think he was wearing glasses.
Okay. You said there was a couple other things. What other things did you see that were?
Another thing that was just once he started. So shortly after he got some sedating medications, I went back to try to examine him a little bit more thoroughly. Now that he wasn't thrashing around,
right?
Was when it stood out to me that there was clearly some sort of medically significant process going on beyond just someone trying to avoid going to jail and acting out, because his pupil size has changed and he started vomiting, and we were trying to roll him over or try to section his mouth out to try to keep him from aspirating his vomit. And it took a long time to get the officers to let us take him out of the cuffs so that we could try to reposition him or suction him, because when you're cuffed to both sides of the bed, I can't roll him or reposition him the way he needed to be to try to kind of protect his airway a little bit. And they were nowhere to be found when I was trying to reposition him, and then kind of gave us some pushback when I tried to get him to take one of the cuffs off so we could kind of reposition him a little bit better. So
talking about the deputy was nowhere to be found.
We kind of got in the way of our care of the patient.
Okay. And I know that there was some rumors and allegations going around about not Richmond County, but the hospital security. Did you see anything from them that was odd or that didn't look right or anything like that?
Not that I really remember. I mean, I know there was at least, as I remember, there were two or three a total like Richmond County officers that were there. Unless you remember interacting with the one I described to you a moment ago.
Right.
And there was like a flock of our security people around there as well, as there typically are in these sorts of cases. But I don't really remember anything out of the ordinary coming from the security staff from our hospital there.
Okay.
There was nothing that I witnessed that seemed off from like what they were doing.
I gotcha. Is there anything else you can think of
that might be like useful? I don't really think so. That's kind of
if
my main thoughts on it all.
Yeah. If you do end up thinking of anything else that stood out to you or anything we might need to know about, this is my work number. So you can reach back out. And I think that's all the questions I have for you. If I have anything else, though, if it's okay, I'll just reach back out to this number, too.
Sure.
Okay.
Okay. That sounds good.
Thank you very much. I appreciate your time.
Yeah. Thank you. Happy to help.
You too. Bye.
Take care.